little disclaimer that I permission, wave your hand if I have your permission to record this and use it on social media, websites, and other online or in areas. That includes Mr. Turret too. You have to wave. Okay. Because I need your permission since I didn't have a worksheet for you to sign that says this and have you send it back. The other disclaimer is that Addicts isn't really my proprietary system. I've learned it from other people and then I've morphed it into my own thing, but that you won't use this in a practice in your own sort. You can use it on family members, but you're not going to use this.
All right, there's some background kind of
low humming vibration going on while you're talking.
our computer.
Is anybody else hearing that?
I don't.
No, I don't.
Lisa and Ann's computers. Can you hear right now? Because the air conditioning is loud and it was on, or the heat, whatever.
Yeah, it's still, hang on.
Did you turn her off?
No, I didn't. Say hello again, Mary.
Hello.
Okay, that is a little better.
Okay.
Okay, can you hear that now?
So, and the other thing is that what I'm teaching you in this webinar does not substitute for in-person and live medical advice or suggestions. And because I have not done an evaluation with you, you need to know that you're doing this at your own risk. And so you're going to wave that you understand all that. Give me a thumb up or a wave. Okay. Hi, Gal.
Hello, sorry I'm late.
That's okay. We just did the disclaimers, so I'm going to run through them really first. I am recording this, and at some point this may be used and it will be shared with other people. And it may be on websites and social media walls or segments thereof. Thumbs up or yes or something. Record.
You okay with that?
Gail?
Me? Yes.
Okay. Also, this is not substitute for in-person and face-to-face healthcare. It is not a replacement for standard therapy in the state of Texas. In order to call something physical therapy, you have to have a licensed physical therapist do an evaluation, and I obviously can't do that in this case. So this is not physical therapy. This is just education for your listening pleasure.
Okay.
Viewing pleasure. And this is a proprietary information if you want to share this with your family members and they accept that, that's fine, but this is not information that you can use, reproduce, or practice with. Yes, everybody agrees? Okay.
Yep.
So I was talking about swelling and how we can have a 30 to 50% increase in the pressure or in the fluid around our cells before it becomes visible. Now, to put that into very visual terms, that's like having a Coke can that's 12 ounces. I have my 12-ounce Coke can, 18 ounces of Coke in it. That's a 50% increase of fluid. Imagine that much pressure in that Coke can. I don't want to open it up. It was an internet picture, right? Coke everywhere. So when we put that much pressure with the fluid and with swelling around our cells, we have a lot of issues happening. It's like letting a baby sit in a dirty diaper. Toxins that aren't moving in and out of the area, they're just stagnating and right there around the cell because you can't get fluid flow when there's so much pressure. It's going to be hard to move any of that fluid. So any cellular excrement or cellular toxins or used up stuff the cell can't use anymore, having a hard time moving away from the cell. So we've got not a clean environment for that cell to sit in. Dis-ease. And dis-ease eventually becomes tissue damage and destruction, right? Want to improve that and not have that ease around or not have those toxins around there. The other thing, again, I already talked about was the collapse of the capillary beds in the area. If there's that much pressure, it's going to squish those capillaries, so we can't get the healthy stuff in there. Blocks our movement. Because if you put that much pressure around a joint, oh, we call it arthritis, by the way. That swelling around a joint, that joint doesn't have normal movement. It can't move the way it was designed to move, if it can move at all. And it's a lot of pressure and strain to move. And so now you're getting not only the cellular tissue destruction and damage, with the limited ability to heal because our capillary beds are all munched up, but we're also getting inability to move, or we get movement changes as a result of this swelling. So this is a big problem, which is why one of the big drugs that's prescribed in today's country, United States at least, is anti-inflammatory medication. We want to get rid of the inflammation. One of the challenges with swelling is it's a mechanical problem as much as it's a physiological problem. So because it's a mechanical problem, meaning more like how my engine works in my car, as opposed to the gasoline that's burned through my car. Gasoline is a physiological chemical reaction that causes the burn, whereas the engine is actually a mechanical structure with moving parts. So we have those two aspects of our bodies, mechanical and then the chemical, physiological. So swelling is more of a mechanical issue than it is a physiological or chemical issue. So even when you take anti-inflammatory drugs, it can take a while for them to work, but changing the anatomical or mechanical problems, they're force a chemical reaction. But as soon as you stop taking the pill, the swelling comes back. So when we start to retrain our system to move better, we actually get more results and we get healthier tissues happening. So what are some ways that we can help move fluid? One is water consumption. And people say to me all the time, well, if I drink more water, I'll swell more. It doesn't work that way, because when we drink more water, our body produces less of the hormone called anti-diabetic hormone. So that hormone tells my kidneys to conserve and save every little water molecule. And when I have less of that hormone, my body says, just dump it all out, just get rid of that stuff, we don't need it. So it actually results in your body dumping more water. So what I recommend is half your body weight in fluid ounces every day, up to a gallon. And if you're drinking that much, you do need to eat salt, because your cells need sodium and chloride in order to function healthy and be healthy. So if you're drinking that much, it helps your kidneys flush water, but you also need, because they're going to start flushing sodium and chloride. I actually have given entire hour lectures on water consumption and how it interacts on a cellular level in your body. And this is a lecture, so I'm not going to go into all those details. I should just say that water consumption is hugely important and valuable to keep the body healthy and to reduce inflammation. And a lot of like naproxen, sodium naproxen, something blah, blah, that goes on for syllables, but it's got the sodium in it. It's partly sodium that's filled. So that's actually what they're using to help change this pump and get rid of swelling from your body. So be sure that you're getting, a quarter to a half a teaspoon of salt throughout your day. I mean, I put it on food. I don't just like eat salt. I'm not going to say I never have, but I usually put a good amount of salt on my food just so that I don't have to plain salt, because it's really salty, That helps to balance out your body and balance out the fluid pressures and fluid flows. is the next thing that helps with swelling. I want you to be able to see my toe. So when I breathe up here, and guess what? When we're having pain, this is right where we go. When we're having stress, this is right where we go. Right up here. I can do that about 3 times and I have a headache, but tend to come up into our necks as we start to breathe when it's like, oh, I got to get all this stuff done. Up here. And what this does is it limits how much breath and how much movement is going on through my diaphragm down here. Locks fluid into my pelvis and into my lower extremities when I am breathing from my neck, because now I'm just doing these little shallow breaths up here, not getting this full expansion. When we're stressed or in pain, we'll hold our breath. And when we breathe, holding our breaths like that, holding the breath, we start to, again, create this lock through here. So this area on down gets locked and the fluid builds up. Rather than saying, wait a minute, here even more and more nowadays that it's like, stop or breathe. Stay calm, open your respiratory passages, because when I start to say, wait a minute, I got to take a few deep breaths, I really breathe down here. Then I'm actually increasing how much fluid is being able to flow through my body rather than causing the locks to happen in my body. So when I'm getting more pain, when I'm getting more stress, when I'm getting more upsetness, my go-to things is, okay, I got to stop and I got to take 3 to 5 breaths. This is especially good at stoplights because you're like, I don't want to wait for the stoplight, right? At least that's the way I am. Change that paradigm in my mind to say, oh, isn't this great? I get the gift of a red light, so I can sit here and practice my breathing and really come in here and get those deep breaths. I even give myself a little hug on the exhale. Do you see how much this went down because my shirt blouse is more? Pulling across the abdomen. What I'm doing is creating a siphon by using the diaphragm to kind of stroke and massage the internal vessels that are moving a lot of this fluid right through here. Giving myself that hug on the exhale, which helps to move that fluid out of my pelvis, of my hips, even of my knees and ankles. When I'm able to include this breathing in my overall wellness program to improve how much circulation I'm getting in my body, and the better circulation I have, the better I can heal. Okay, so now I'm going to show you how to manually, which means with your hands, work on your lymphatic system. And the neck, I always start at the neck, or at least 9.9% of the time. Start at the neck because 25% of our lymph nodes are contained between this line and that line. And so I want to stimulate those nodes because it's like, I think most of us are old enough to probably have seen that movie Back to the Future with my box, where he takes a giant volume button, you know, on the screen, and he turns it way up and blasts himself back out of the room. Work on our neck with our lymphatics, we actually turn the volume up for our entire system of lymphatic flow. So if you find your collarbones, and we'll lean into the camera, I don't have those bony collarbones, some ladies do, but bones, and then you gently ease right above them, and right above them there's a little depression. So if possible, if you can feel that. So on that little depression, I'm going to show you big and into the camera. A gentle press with my finger, with the balls of my fingers. So they're kind of like this of the collarbone, but gentle depression and a stroke in and down. So the stroke is coming in towards my collarbone. Here, I'm going in and down on my collarbone. Really. So this should be light enough that it is not uncomfortable at any level. It should not be uncomfortable. Not make your skin turn red. If you're making the skin turn red, you're pressing too hard, lighten up. It takes a very gentle pressure. It's like sliding your skin. Top, you can see that little slide. It's sliding the skin on top of the muscle underneath. So I'm not digging into the muscle. I'm sliding the skin on top. I'm kind of just putting a little pressure into the muscle. And as I do that, I literally can feel the top of my head and the fluid. I've ever done it, just so you know. It's bugging me. So as I do that, I might do it 10 or 15 times. Now I know Allie, because she shared this, I hope you don't mind if I say this, but she's been having an ear issue. So if I take the backs of my fingers up my neck towards the bottom part of my ear. So I am not digging in. You never ever want to dig in here. That's why we use the backs of the fingers. It's really hard to dig in with the backs. Stretching always in one direction, which is down to my collarbone. In one direction down towards my collarbone. And this helps open up inflammation from the ear jaw area. Just gently gliding it down. Headaches, ear congestion, sinus congestion. When I'm working with somebody here in the clinic, I frequently have people either start coughing or, you know, I feel like I'm choking because there's so much fluid that starts going down the back of their throat. As I do this. Again, I've been doing this a long time, so I can be really specific, but even doing it generally with just the backs of your fingers down the sides of your neck, stretching that skin. I take short little strokes because I run out of stretch in my skin. It's like, that's all the further she goes. So I lift up my hands and reposition. But this can be helpful both for clearing out sinuses, opening up ears, addressing headaches, calming. This is very calming. It increases beta brainwaves, by the way, to do that. Okay, so I want you to see my abdomen more than my face right now. So if you have a recliner chair, that's great. If you're like me and you don't right now, because I'm at the office, we don't have recliners at the office. I'm a dining type chair, a hotel chair. So I'm putting, here's my belly button. I'm going to put broad, flat hand area button and below my rib. I'm going to put the other hand, same area of the hand on top of that, and I'm going to roll from my belly button up my chin. So sink my hand in and I roll. Now this should not feel, no pain, no gain, does not apply in this situation, ever. Okay? Ever. That's so important. I am not digging in and I'm not hurting myself. My hands here and I gently roll up. I'm adding my breath, right? You can hear that. So what I'm doing here is I'm creating and facilitating that siphon. So fluid from my legs and from my pelvic area. Who have, say, pelvic problems of many and differing kinds, to reduce the pressure that sits down in your pelvis and causes some of that SI joint pain or bladder incontinence or all sorts of things, right? So if I roll up and do some of those breaths, truth is, in the clinic, I never count this. I can't tell you the last time I counted this because I do it all by feel. When I first started, which was about 20 years ago, 21, doing these activities, 10 to 15 strokes, because I had not learned to feel the tissues. Now I do it until the tissues kind of go soft. When you first feel your tissues, you can go, how soft, how firm are they? And come back and go, oh, yeah, they're softer. Okay, so the fluids are moving. So say to me, oh, I'm losing weight because, you know, they get all soft, and I'm like, no, you're losing fluid. You can't lose weight that fast. You can't lose fat. So doing just a few scoops over here to each side just to kind of move stuff from the side into the middle, and then doing a few of these. Another person coming in. Okay. So we're not done yet because we still have to get lower, right? We're not down to our legs. So this is a Y. I've got the line here, then button, the line splits and goes down to the top of each thigh. Well, you've got a lot of lymph nodes in this area. I call it a mother lode node. Just under my hand is just a pile of lymph nodes. So if I go above that along this line where my thigh connects to my body and my pelvis, I'm going to do that same scooping, lifting that up towards my leg of my Y. And then I'm going to do that on both sides. Start at the end and work backwards. Because a lot of people want to just go to where the problem is and focus on that. Many of you live in Dallas. Some of you do, some of you do not. There was a hurricane in Houston, and everybody said, evacuate Houston. And for some reason, most of Houston got on the road and tried to come to Dallas, and they ended up in the highway between Houston and Dallas because they didn't open up or prepare the roads or prepare Dallas to receive all these people. And so because of that, there was no place for them to go, you know, no room in the inn. So turning the highway into a parking lot because Dallas couldn't receive all these people. So when we open up our system, starting at the neck and then working down the body, we're opening up the pathways so that now when I come to my legs, okay, I'm going to stick my leg on a stool. I've already opened up all of this other fluid, so there's a place all the highways are able to accept and receive from the lower places, from the other places that are sending, right? So then I'm going to come in my thigh and I'm going to stretch tissue coming up towards my heart. So my stretch is always, always up. Into the muscles, I'm just stretching them up towards. If I have a knee problem, I'm going to do what I call the scoop, which imagine my hands are like this under my knees, but you can't see them. So I'm going to do like this. I'm going to scoop to bring the fluid up out of my foot and ankle. And then I'm going to continue down into my leg and knee. If I'm somebody who has pelvic issues, I can also scoop from around the sides because all of this fluid from the back is coming into this load, is like the mother load of nodes, of lymph nodes. I'm going to bring those around and put them back into those lymph nodes. Now, when I'm done with all of that, I'm going to again do this a few strokes, maybe 5 to 10, and then do this a few strokes. The reason why I'm going back through all these areas I look at it as first we're opening up and kind of washing and cleaning out the major mud. And when we back through it, we're rinsing to make sure all of that is still moving and going. So that is a really quick overview of how can I stimulate my lymphatic system. And even if you do that once a day, you get good at it, you can do it in what, 5 to 15 minutes, 10 minutes most, to do those strokes, to open up your lymphatic system, to help your body begin to have what it needs in order to heal these different areas and restore them to their normal health in place. Okay, so I am going to turn the floor or the screen over to Anne, who is going to talk a little bit about how, and I'll let her give you a little introduction to her resume, but she's going to talk a little bit about how our emotions and how feelings and how stress contribute to some of these issues. Go for it, Anne.
Thank you, Mary. And I'm going to be asking questions throughout, and the personal application questions, please put in the chat if you'd like to. And other questions, I'll be saying, well, questions or comments, please just speak out at any time. And as far as introduction, I am a retired medical doctor and psychiatrist. And when I went through my medical training, I used to grieve the suffering of my patients. I would come home and cry. I would pray, Lord, why? Why do these people have such pain and disability? And to my surprise, I started hearing their souls tell me why. And there was always a very good reason. For example, I had one infant patient in the hospital who was on a ventilator, and she had a degenerative illness that caused her muscles to waste and weaken, such that ultimately the baby stopped breathing and usually died by 1 year of life. So it was heartbreaking to me to work with this little girl. And one day I looked into her deep, big blue eyes and said, I know this must be hard for you because it's hard for all of us, but I'm wondering is there some reason why you're doing this? And it wasn't long after that, her parents came into the room and I told them my question, and Mom spoke up first. She said, baby Marcy is an angel in our lives. She has touched us so deeply. She's taught us that every moment is so precious and life is so short. And she said, I used to be very superficial, working about my makeup and my fashion, that sort of thing, how my hair looked. But now, she said, before actually the baby was on a ventilator, she would introduce her baby everywhere she went, to nearly everyone she saw, because she wanted this precious life to touch more lives than her own. And she said it's really expanded her world. And then Dad spoke saying, well, I didn't think emotions were anything to talk about, and as a sign of weakness. But every day I cry for my baby. And I now realize that emotions are about care. You care when you show your emotions. And he said, he's dripping with tears. He said he's owned that part of himself and he's so grateful. So I turned to this baby after Mom and Dad left and I said, and now I understand why you're doing this. And you have such a good reason, you dear, sweet soul. And this is what I found with all of our illnesses, our injuries, our accidents, whatever's going on in our lives, there's always a good reason on the level of the soul. And as a soul listener, I listen to these very good reasons and know that every misfortune has something significant to contribute to our lives when we just understand what it is. And by the way, I define soul as the psychological body, which includes the emotional heart and the mind. And today I'm going to be talking to you about the soul communications in our body symptoms, such as our swelling in the abdomen and pelvis and lower extremities, if we have time. But before I get started, I want to give you a brief summary of the psychology of the average person. Most of us have severed souls. We don't look at life, we don't perceive in a holistic manner. As a matter of fact, we're largely focused on the physical, what's most obvious. And we expect children to be what's obvious. We expect males to show masculine traits and females to show feminine traits. And when their psychological bodies are not following these rigid dictates, particularly when they're young, we discourage what we believe shouldn't be there. So males with boys, we discourage their tender, emotional, feminine sides. And these boys learn that this girl inside them is foreign and unwanted, so they separate from her. And some boys abandon their feminine side altogether. And this girl living inside these boys runs away to live an independent existence. Similarly, in girls, we discourage their tough, seeking to assert himself, masculine side. So they separate from him. And sometimes girls are brutalized for showing masculine traits. I know that was my experience. So this masculine inside the feminine is not okay. And that little boy inside girls feels unwanted, unappreciated. So he runs away to live an independent existence. Now, the problem with this is that these immature parts of us, well, they stay immature because they're not part of our growth producing life experience. They stay psychologically very young. And their behavior is true of their psychological age, not the body's physical age. So the problem here is, well, there are a lot of problems because this immature behavior doesn't fit into our world. These parts of us have strong feelings and they act them out in such immature ways. They're upset with us because we've rejected them. And they tend to be jealous of us and what we care about. So they might make mistakes at work and get us into trouble, or they say and do offensive things to our loved ones. So it's a big problem. And people typically tell us what we've done through these very young parts of ourselves, but we say, I didn't say that. I wouldn't do that. And we think these people are either making up stories to make us look bad, or maybe they're just nuts, but we don't believe them. And this is where our souls come in, because they try to alert us to what's going on within our psychology. So they alert us to these inequalities between the masculine and feminine, because most people aren't equally aligned. One's more dominant than the other. So our souls try to bring that to our attention. So can you think of a way that a soul might use the physical body to give the message of inequality? One of the things that comes to mind for me is a stroke. Might leave someone with weakness on one side of the body, or even being paralyzed on one side of the body. Another thing the soul tries to communicate is qualities of these immature parts of ourselves, meaning that they can be very self-centered, inflexible, overly imaginative, lacking assertion, fearful, insensitive and caring, and so on. So how might a soul communicate these qualities through a body? We might get a devastating illness and suddenly we're being incredibly self-centered, bringing our self-centeredness to our attention. Maybe we get a sports injury that results in inflexibility of a joint, bringing our inflexibility to our attention. So our brilliant and loving souls are using body language to bring these dynamics of our psychology to our attention so we can make some much needed changes. Now, is this clear to everyone? Are there any questions? Because this is really important to understand. What might this symptom of swelling in our bodies mean? Well, as Larry was mentioning, our bodies are meant to be flowing, and the body fluids within our bodies. And our psychological bodies are meant to be flowing, meaning our authentic motions should flow out of us as we go about our days. And our genuine thoughts need to flow. And we need to be sharing ourselves with the right people as we go about our days. We have a masculine side for a reason. We have a feminine side for a reason. We need to flow back and forth between these two sides. There's a time to be strongly assertive, telling what we know to be true, no matter what the consequences. We need our masculine side to stand up to our traumatic world, where people can use us for their purposes with little regard for human life. So sensitive. We need our feminine side to sense into our heart and our gut empathically to know how to help everyone in their ever-evolving humanity and lovingly accompanying them as they work through the many traumas. When we don't have this fluid movement going back and forth between our masculine side, the unassailable masculine, or the ever-nurturing feminine side, well, our bodies may bring this to our attention by a lack of flow in the physical body, some sort of swelling. So when we're not flowing properly, our body fluids likely aren't flowing properly either. If you have any swelling in your physical bodies, you might take a moment to consider where there might be a lack of flow in your psychological body. For example, are we confident in asserting our unique voice and fulfilling our God-given mission with unwavering determination? Are we sensitive to seeing where people are along their developmental journeys and giving whatever they need to progress psychologically? Yes, our emotional bodies and minds are meant to develop just as much as every baby born into the world needs to develop physically. We know how to sense into our bodies and say, oh, I'm hungry or I'm thirsty. But we grow to learn to hear our heart hungry for love and our mind thirsting for truth and knowledge. And when we don't have this awareness of heart and mind and their needs, there's a block present. And that block may manifest in some sort of block in our physical body. So let's say I'm blocking my masculine self, having learned that women don't need a masculine side, that's inappropriate. Well, that might show up in my body somewhere. Like, say I get a blood clot in my right leg. In my healing community, the right side of the body is, we typically see that as something communicating the masculine within us, and the left side is the feminine within us. So you might take a moment to consider if there's any difference between your right and left side and what that might be saying about your masculine side and your feminine side. And this is true too if you see any difference in functioning, any increased stiffness, less ability on either side, what that might mean. And let's say a man is out of touch with his feminine side. What might that manifest? One thing I see a lot is that the emotional heart expresses itself through the physical heart. Take just heart failure, for example, that causes swelling in the lower legs and feet. So the lack of flow of emotions is showing up with a lack of flow in the body. And also, whenever I see a pooling of body fluid, I think about grief stuck in the body, because tears are made out of body fluids. And there is always a lot of grief that's unexpressed, I find, because losing parts of ourselves causes grief, whether we know about it or not. Now, another thing that causes body swelling is salt retention. And salt, sodium chloride, is, well, sodium is a +1 charge and chloride is a -1 charge. So again, I think of the polarity, the balancing of the masculine and feminine, and being asked to look at polarity within our psychological body. And I'm thinking of a good friend of mine who read a book, and I don't recall the name of it, but he said they've researched all over the world, men and women, hoping to have a list of adjectives of what a man is and what a woman is. But what they found instead was all over the world it's different based on culture. But the one thing that was absolutely clear the world over is whatever a man was, the woman was the opposite, and vice versa. So to me, this was confirmation that we all have a man and woman inside us, the masculine and feminine side. And it's culture that delineates what it is to be a man in this particular area or a woman in that area. So you might take a moment to consider your culture that you grew up in. What did you learn is to be a man or to be a woman? And how has this affected your life? Of course, you may be thinking, as sometimes swelling is just, well, it could be weight gain. It can just be extra weight. The person looks swollen. And while that can be true, to me, there's always a psychological component. There's always some sort of extra weight we're carrying around, maybe some old traumas of the past. And our bodies are asking us to look at what we're carrying that we need to work through and let go. So is there any question on this material? Any comments? Okay, well, let's look at swelling in the abdomen. Now, the abdomen is where we have our digestive organs. So a physical doctor would be looking at digestion if our abdomen is swelling. But psychologically, we're looking at psychological digestion, meaning are we taking in the emotions that we're seeing throughout our day? And are we receiving mental nutrition that's coming to us throughout our day? This is very important because our emotional bodies are meant to be growing just like our physical bodies. They're meant to express all the emotions, feel deeply with all the emotions, be sensitive to all the emotions, and express them in creative and clever ways. Our heart just gets bigger and bigger. We grow to care about everyone and all life. And similarly, our minds need to be taking in the mental nutrition, the truth and knowledge that comes our way. And as a result, our minds expand We grow to be more abstract in what we receive and give. And we grow to see that all life is, everything going on around us is ever communicating with us, guiding us, and giving us knowledge. So back to the body. Gas can cause physically distended belly. And what this can represent psychologically is we are either taking in or producing a lot of hot air, things that aren't genuine, like inauthentic emotions or fake news. We really have to look at how we're properly digesting, just like with the physical body. We might be taking in the things that don't agree with us, like a lactose intolerant person. And what might that mean that what's not agreeing with us? Because I'm thinking of a woman who had a severe allergy to milk, and through meditation, she realized that she was actually reacting to a bad situation she had when she was drinking milk. And all that problem about that family situation was directed toward the milk, and she couldn't have milk after that, was lactose intolerant. So it's always interesting. There's so many layers of meaning when we start hearing the soul. And also, roughage is something that commonly causes gas. And roughage to me psychologically can mean the rough parts of our lives, getting the nutrition out of the most difficult, most painful circumstances, like what I learned from baby Marcy. And one thing to know about soul communication too, it can be a direct communication. Like if we have a distended belly, it might just be that we're eating too much. And that might be saying we're taking in too much, something psychologically too much. But it also can be an indirect, or telling us where we need to go. As far as if we're eating too much, it may be an indication we need to be eating more emotional nutrition. We need to be eating more mental nutrition. And a painful swollen belly can be all sorts of chronic diseases, like irritable bowel syndrome. Irritable, the very word means a form of anger. So is our body telling us that it's angry about something we're taking in? It's not agreeing with us. So let's pause for a moment and ponder any abdominal swelling you might have and what your soul might be communicating through it. Does anyone want to share? Well, then let's move on to the pelvis. In my experience, swelling within our private parts is definitely an indication to look at our masculinity or femininity. For example, swelling in a man's private part, it's telling him it's time to look at how he believes what he believes about his masculinity, how he feels about it, how he's expressing it. And a common problem in middle-aged and senior males is benign prostatic hypertrophy, for example. And it causes the prostate to swell, and it blocks the flow of urine. So these men go to the bathroom a lot more frequently than normal males. And I remember once working with a guy I'll call Rex, and he was really over masculine, and his body was telling him that through the swelling of his male organ, the prostate. And he, in his dominance, felt it was his right and duty to control all his family members. He was head of the household. So his soul was telling him by blocking the flow of urine that he was blocking their development. He was keeping them young so he could control them. And so his soul was trying to bring that to his attention through this illness. And of course, illnesses have a range of severity, going from mild, something like a cyst in a woman or an allergy, to infections, to something really life-threatening like cancer. And the more serious the problem, the more urgent the need for change. And I'm thinking of, as far as females are concerned, I was with my little niece. She was 3 years old at the time. And a woman was saying, oh, she is just so sweet, just so loving, affectionate, really does everything she's asked to do, not in any way oppositional. What a wonderful, wonderful little girl. And I realized that these were the exact terms I grew up with as what a woman was. And it was in that moment I thought, oh my goodness, a woman is obviously a lot more than this. And so she is. But if we don't have some of these problems in our female parts, we may never know there's so much more. And one thing to always consider with pelvic problems too is unresolved sexual abuse that's showing up. Unresolved pain or guilt or shame might show up in problems in the pelvis. So whenever there's a chronic illness in that area, it's always important to investigate the potential for unresolved sexual abuse. But in our culture, we are taught to think in terms of right and wrong, as in, if I have an illness or an injury, there must be something wrong with me. But I look at life more as we're here to learn, and there's always more to learn. So I don't wish to have people feel uncomfortable or like feel bad about themselves by this information. To me, it's hopeful. If our symptoms and disease processes are wanting us to learn something, we have an opportunity here, and we can live happier, healthier, and more fulfilling lives. Because our ailments aren't just physical or emotional or mental, but they're all of that, because we are all of that. And this understanding of soul communication means our bodies have the capacity to heal, no matter how serious the illness, when we're willing to follow our soul's brilliant and loving guidance in returning us to wholeness. Are there any questions?
Check out the chat, Anne. There's a couple of comments in the chat.
Okay. Oh, kidney stones. What might kidney stones mean? Well, stones, in my experience working with people with kidney stones, something rocky inside them. And what can happen with these castaway soul parts is that because we put them so often, we put them in the unconscious mind, we forget about them. They take the parts of our lives that we're not comfortable with, all the traumas, all the extreme rejection and abuse. So they can get very rocky, very stony, inhuman. They regress, become younger and younger in psychological age, so much that they're not even human anymore. They can be so violated. And sometimes our kidney stones are representing those stony parts of our psychology. Does that make sense?
Yep.
Anybody else have anything to add to that they can see in kidney stones?
I know I read in one book that, and this goes with what you were saying, in one book that I was reading that was connecting the physical to the emotional, because I see this a lot in physical therapy practice. And that is that kidney stones can represent hardened anger, where I wasn't, I had to bury these feelings so deep inside me because it wasn't appropriate to show anger. It wasn't appropriate to say, hey, what you're doing isn't okay with me. So I'll just put it down in these hard mineralized lumps where, I'm not dealing with them, but then they become very physical.
Yes, absolutely. And as we've been talking about throughout our talks, is our bodies are meant to flow in every way. Our emotions are meant to flow. Our thoughts are meant to flow. And anything held back, yes, it can calcify. And what happens? We get like calluses on our feet. We get stony things in our bodies. Yes, trying to bring these parts of our souls to our attention.
And then as we become aware, we actually can then take the action to, I've had things that I became aware of it because it was in my body. I became aware of it. I was like, oh, this is what this means on an emotional level, in addition to the physical that I'm dealing with. And once I become aware, it's just like, boom, I'm no longer dealing with it because all I needed was the awareness to say, oh, I can change this now, I'm done. But before I allow myself the awareness, then I'm still carrying the restriction or the barrier or the blockage that keeps that dysfunction continuing to pattern in my life and my body.
Yes, and when things don't go away, it's often we're not getting to those deeper layers and we're being invited to go deeper. And as far as a partial hysterectomy with pain, the pain to me, again, whenever there's a physical pain, there's always a psychological pain that goes with it. That's been my experience. And to get to what that deeper pain is about. And again, there's a gift, even though it's absolutely, suffering, pain. I don't like physical pain. I don't like it at all. But when we get to that deeper level of what it's flagging, it can be a real gift when we work it through. So I just want to invite you all, if you would like to have a free soul listening session to see what some of these physical things might be communicating to you personally. My email is gardenerofthesoul@icloud.com. And let's get together and have a free soul listening session.
And on the bottom of the workshop that went out with the email, if you got the email last night with the Zoom link, I'm assuming you guys did because you're here, and that's the only way I sent the Zoom link out for today's meeting was through that email. So yeah, she has an email. Actually, there were 2 emails that were on that sheet, and her website, which you can also contact her through there. So, yeah, my experience as a physical therapist and the reason why Ann and I partnered to do these workshops was because I have a lot of people that, as I'm working with them, I really see that there are traumas in their lives which are blocking full restoration into function and into restoring the tissues. And people will say to me sometimes, well, you think this is psychological? And I'm like, so I think the tissue damage is absolutely real. Because we get the swelling, we get the protection, we get the cells sitting in cellular excrement or cellular poo-poo, as I like to call it, going on. And this damage is absolutely real and measurable. It can't just be fixed theological, meaning drugs, or with surgical, or with strengthening, stretching, and balancing of the body. There are other components that help to restore the body to wholeness. And that's why I wanted to invite Ann to explain some of this during these workshops so that people have the opportunity to also engage in some of that type of work to really restore those tissues and to wholeness. So our next workshop is going to be on Monday, February 1st at 10 a.m. I will send you an email Saturday or Sunday with this link and with worksheets. This workshop, that one on Monday, will focus primarily on body power system and doing some more movements with body power system and helping people correct those imbalances and retrain the brain to utilize body parts, because research is showing if the body isn't trained or doesn't know, if the brain doesn't know healthy movements available, it continues in a dysfunctional pattern. So this helps the brain to learn and to utilize healthy movements by practicing and seeing what the healthiest movements look like. So we're going to go over some different movements that we went over this past Monday. We'll again send that email out on Monday, or no, I will send it out on Saturday or Sunday. And you can, that particular workshop, you really need to have had the one on Monday to understand the one on this coming Monday, February 25th, to understand the one on February 1st. I'm not going to re-go over all that information. I'm just going to kind of keep moving forward with a really brief review. So, not ideal for brand new people to come, but I'm going to put my email in the chat. And if you want to come to the next workshop session to learn the body power system, you can do that.